Ready, prepared to do a selfless job. Strength, ready to put themselves out there on the city streets across our nation. Remember, they have families of their own. Teamwork, they work as a family while risking their lives. Patience, having to deal with decent people behaving badly. Compassion, understanding the pain that others are enduring. Restoring, helping those who have lost control to regain their balance. Circumstances, working to get people to safety. Self-sacrifice, take care of the injured despite the danger. Tragedy, no matter how large the disaster, they respond. Hope, the devotion of those who are out there serving us. Staying strong, getting those that cannot help themselves to safety. Finding a way, looking past the danger to reach those that need help. Ladder, they climb each step, risking their lives, lunging into unexpected danger. Knowing every second counts when you cannot help yourself. Wounds, those who are hurt and those who are scarred in the process of helping. Together, working to hold on to life. Determination, working together no matter what it takes to save a single life. What are the risks that firefighters and law enforcement officers face when going about their daily workday? Are their jobs more dangerous than other professions? You have seen a number of depictions of firefighters and police officers engaged in dangerous situations. How does that make you feel? Do we think their work is more dangerous when compared to other jobs? Do statistics reveal that firefighters and law enforcement officers face greater rates of morbidity because of the nature of their work? Over the course of this presentation, let's explore the rates of morbidity for the professions of firefighting and law enforcement when compared to a number of other professions. And welcome to my talk. Hello, my name is Dr. Lou Rotkowitz. I'm a graduate student at the City University of New York School of Public Health and Health Policy, I am working towards my master's degree in public health with a specialization in environmental and occupational health sciences. I'm very passionate about what I do. Okay, so let me take a moment to tell everyone a little bit about myself. You may be wondering, am I a firefighter, a cop? Am I a doctor? Well, I got my Bachelor of Arts in Biological Sciences at the University of Delaware. I went to medical school at St. Matthew's University School of Medicine, which at that time was in Belize, Central America. I completed a general surgery internship at Nassau University Medical Center in East Meadow, Long Island, New York. And then I completed a family medicine residency at Albany Medical Center, which, as you know, is the capital of New York State. I'm board certified in family and community medicine. I am a fellow of the American Academy of Family Physicians. I'm board certified in urgent care medicine. And I work in two New York City emergency departments that are extremely busy. This is how I pay the bills. I'm a physician for the New York City Fire Department. I also work at FDNY's World Trade Center Health Program, caring for victims of the 9/11 attacks. I'm a New York City Fire Department online medical control physician. I'm also proud to be the team physician for the New York City Fire Department's incident management team. I'm an honorary surgeon for the New York City Police Department. I'm a ringside physician for the New York State Athletic Commission. And finally, I'm also an honorary surgeon for the New York State Troopers, PBA. Today's purpose and objective: we're going to assess both the incidence and severity of occupational injury in law enforcement officers and firefighters across the United States. Okay, this is our roadmap for our discussion. Please take a few moments to review this before we throttle on. All right, let's get started. Let's take an overall look at the United States. I took some data from the Bureau of Labor Statistics, and using GIS software, specifically a program called ArcGIS, I was able to map the incidence rates of non-fatal occupational injuries and illnesses. This is just a technical way of saying I created a map that shows which states have the most non-fatal occupational injuries. Okay, to clarify, non-fatal occupational injuries are injuries that do not result in death. So you can see here that the states with the highest rates are Maine with 4.7, Vermont with 4.6, Washington State with 4.3, Montana with 4.2, and finally Oregon with 4.0. I should mention that the states in gray, we had no data available to us. Again, these are injuries per 100 full-time workers. And again, this information was obtained from the Bureau of Labor Statistics. Okay, let's just simplify again. In all of these 5 states, on average, for every 100 full-time workers, roughly, 4 or more will have some sort of non-fatal injury at or because of work. This data, again, is for all types of occupation across the United States. Okay, so let's hone in on occupation types and see how the rates of non-fatal occupational injuries compare by industry. Again, I used the data obtained from the U.S. Bureau of Labor Statistics to create this temporal graph of incidence rates from 2010 through 2016 by occupation type. Let's go ahead and break this apart. You can see that the lowest rates of occupational injuries across this time period are for those in education. Public school teachers, teachers' aides, guidance counselors, and even university professors would fall into this group. Next, jobs and utilities are a bit higher. So we're looking at people who work as electrical workers, water and sewage workers, telecommunication workers, or basically the folks who bring the internet to your home. Next are healthcare and social justice. These are similar. These are people such as caseworkers, physical and occupational therapists, adult and child protective service people, and nursing home staff, just to give an example. Next, we show local government in orange, my favorite color, as you know. These have similar rates as well. These are folks that work in parks and recreation, highway and road maintenance, public transportation, the people who operate subway and buses, and support them. And then hospitals. As an ER doctor, I can tell you it's nice to see that the overall rates of workplace injuries in hospitals is decreasing over the years, although I find this somewhat hard to believe. So again, in this category of hospitals, this would include everyone involved in the operation of hospitals: doctors, nurses, pharmacists, all the various therapists, just to name a few. I'm sure you can name many more. Next up is public administration. And I'm kind of wondering why they have such a high rate of injuries, especially compared to sanitation workers. This seems to be beyond me, and this is beyond the scope of this talk. Examples of public administration, according to the definition from the Bureau of Labor Standards, are these are folks that are involved who supervise, direct, and coordinate and implement government activities and policies. These are city managers, public works administrators. Next is goods producing, and that is much higher, which isn't surprising, as many of these people work in factories. So these are your factory workers, auto workers, anybody that's producing goods. Last but not least, we have those who work in justice and safety. So people like security guards, emergency responders, probation officers, correction officers, and of course police officers and firefighters. Now that we've covered the overall breakdown, let's take a closer look at this high-risk group. Now, we just saw how emergency responders such as police officers and firefighters have significantly higher incidence rates of occupational injury than other occupations. So let's take a closer look how they compare to other local government jobs. So here are the incidence rates of occupational injuries for local government employees. Take a look. And look at how starkly they compare to police officers in the blue, a very appropriate color. We can see that the incidence rates are nearly double that of other local government employees. And finally, the red. Take a look at the red. Red for fire. Here we have the incident rates for firefighters. We see a lot of similarities with police officers, but we can also see that in 2010 and 2011, firefighter rates of workplace injuries were over 20% higher than that of police officers. We also see much higher incident rates for firefighters in 2014 and relatively comparable rates in 2016 and 2013 with firefighters and police officers. Okay, this is a heat map. Take a look. The warmer colors, such as the reds and orange, are indicative of higher rates. The cooler, greener colors are indicative of lower rates. In keeping with the theme of this presentation, these are number of cases per 100 workers. So, let's take a look at the law enforcement officer group. We see, on average, the number of cases of occupational injury vary from 10.2 to 11.8 over this 6-year period. Now, in firefighters, the number of cases of injuries has been as low as 9.5 and up to 13.9 cases per 100 workers. In some years, we see that the rate of injuries are quite comparable between the law enforcement officers and firefighters. However, what is drastically different is that despite having somewhat similar rates of injuries, there are a greater number of cases with which firefighters require days off from work compared to law enforcement officers. Approximately 44 to 54% of injuries endured by law enforcement officers require days away from work, whereas a whopping 57 to 66% of injuries experienced by firefighters require time off from work. Ultimately, this suggests that while the rates of injuries may be somewhat comparable between the two professions, the severity may be quite different. This is more clearly depicted here, where we can see that the percent of days requiring time off from work is the lowest for government workers, followed by law enforcement officers, and then we see that firefighters experience the highest percentage of injuries that require time off from work. And so, for good measure, let's make sure that this difference between these workers is actually statistically significant, and it's not just due to chance. I took the data and ran some t-tests. As a reminder, if t is greater than 1.98, then that is indicative of a p-value less than 0.05, which subsequently means that there is a significant difference between the two groups. And this is highlighted in green. Okay, so looking just at the number of injuries, we can see that aside from 2010 and 2011, there really isn't a statistically significant difference in the actual number of injuries between law enforcement officers and firefighters. Essentially, that means that the average number of injuries between the two groups are quite comparable. However, when we take a look at the cases of injuries that require days away from work, we see that in 2010 and 2011, and again in 2013 and 2014, the injuries endured by firefighters require more time off of work when compared with that of police officers. And this difference is statistically significant. Okay, so when we look at these statistics overall, by pooling the injury rates over the years, we see that on average between 2010 and 2016, firefighters experienced 12% more injuries that required time off when compared to law enforcement officers. In short, this difference is statistically significant, shown here. In conclusion, while the rates of injuries between law enforcement officers and firefighters are similar, it can be inferred that the severity of injuries experienced by firefighters are worse. This has important policy implications. Okay, I hope you enjoyed my presentation and learned some interesting things. Please feel free to reach out to me with your thoughts and comments. Thank you so much. So long.
to 584. D5. Adam Young, 1955. Okay. 23, we're at 10th and Grant waiting for a telephone. I believe it was called on channel 1.